Ready to begin, Chairman.
Yeah, Denisha, would you begin today by calling the roll, please?
Yes, Chairman. Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
David Cruz,
Here.
Cynthia Rucker,
Here.
Nelva Lee,
Here.
Anthony Williamson,
Here.
Shane Mobley, William Coles. Mr. Mobley, if you're on the line, could you please make sure that you've unmuted yourself? Chairman, that concludes my roll call.
Thank you, Denisha. We'll deal with any issues here with not being able to connect, maybe with the first time in for the new board members there. So we'll.
I'm here now.
Oh, okay. Thank you, Shane.
Sorry about that.
No problem. All right, and welcome everybody. We have a quorum to conduct our business today and call the meeting to order. We have a rather full agenda today, and we'll move right into that. We have actually 4 items here that we will be asked as a board to consider for final adoption, and we'll talk a little bit more about that in a moment. But first of all, I'd like to call on Russell Crutchfield, our board secretary, to see if he's had a chance to review the minutes of the June 2nd meeting, and if he in fact could recommend that they be approved.
Good morning, Mr. Chairman, and happy Monday. I've reviewed the meeting minutes from June 2nd, 2022, and I found them to be correct and in order. I move that we approve the June 2nd, 2022 Board of Community Health meeting minutes.
Motion has been made by our secretary for minute approval. Is there a second to that, please?
Roger Folsom, second, Mr. Chairman.
Mr. Folsom has seconded that motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, the minutes are approved. In my opening remarks this morning, my pleasure to welcome 2 new board members. Dr. Robert Coles is replacing Dr. Davis on our board, and I believe he was unable to attend today because of previous commitments. And secondly, Shane Mobley, welcome him to our board, replacing Russ Childers. And Mr. Mobley, would you have any remarks you would like to make at this time? We're happy to have you as a part of our board.
Yeah, Mr. Chairman, I just want to say I appreciate the opportunity to be on this board and work with you all, and hopefully my experience and background in rural care and healthcare will be a benefit to the board in the state of Georgia. So with that, I appreciate everything and look forward to working with everyone.
Thank you. That concludes my opening remarks to the meeting. And at this time, I'll turn it over to Commissioner Nagel for her report, please.
Thank you, Mr. Chairman. Good morning, members of the board. Just a couple of quick updates for you this morning. In case you didn't see or hear it otherwise last week, the federal public health emergency was officially extended late last week. The new extension will run through October 13th of 2022. As a reminder, that will mean that we will continue to maintain most of our Medicaid members on our rolls, unless folks move out of state or have some other or become deceased or some other termination reason. But by and large, most of our current Medicaid members will continue to maintain eligibility at least until October 13th. As a result, we'll also continue to suspend premiums and copays for our Peach Care for Kids members. We'll continue to provide reimbursement at $40 a dose for COVID-19 vaccine administration. And while additionally, Appendix K flexibilities will also stay in place. While we know that the waiver, or excuse me, the emergency declaration will extend through at least October 13th, we're unsure of what will happen after that, but we'll continue to work with our partners at DHS and DFACS for what a potential unwinding will look like whenever the eventual end does happen. And so looking at what staffing level looks like, what other those flexibilities and unwinding those will look like, and how we'll go about actually redetermining eligibility for our 2.5+ million Medicaid members whenever that emergency does officially end. In positive news, our comprehensive support waiver, our comp waiver, was officially approved by CMS, I believe, over the weekend. This is a waiver that provides supports to our individuals with intellectual and developmental disabilities. And we've gotten a renewal for 5 years. So I just want to applaud Lynette Rhodes and her team, as well as folks in finance and others that all played a big hand in getting that renewal completed. So we're very, very happy about that. We have talked about the CMO reprocurement a number of times. We had put out a request for information early in June, and that RFI period has now ended. I believe early estimates are we received over 50 responses to that RFI, and so the teams are now working to review and synthesize that information so that we can use it in our planning purposes going forth in the coming months. A couple of quick staffing announcements. Hopefully you saw the announcement, but we have welcomed Russ Carlson as our new Chief Health Policy Officer. He brings with him numerous years of experience in both healthcare as well as state government policy and operations. So we're very, very happy to have him on board with us. Welcome to Russell. And then, as I like to do, mention our employees that are celebrating milestones in the month of July. Cynthia Mitchell from Healthcare Facility Regulations is celebrating her 5 years with the department. Jose Ward Barton is celebrating 10 years from IT. And Tanya Bass and Linda Walker Woody, both from the Office of the Inspector General, are celebrating their 15-year anniversaries of the department. So thanks to those employees for their continued service. That, Mr. Chairman, that concludes my report. Happy to answer any questions. Thank you.
Any questions or comments for a commissioner from the board, please? Hearing none, thank you very much. We'll move into our agenda for medical assistance plans, and we'll call in Lynette Rhodes, Executive Director of Medical Assistance Plans. And Lynette, I believe, has 3 separate things that she will present. For our new member joining us this morning, just as a little bit of a background of the process and how this process works, and a refresher course for some of us. As a department brings before the board items to be considered for voting on this board, initially they bring to the proposal an initial request for approval. And following that initial request, the next part of the process, and we don't have any initial today, these items have already been initially approved. But following that approval, if in fact it is granted from the board, then it goes into a public comment period where the department holds open meeting for people to provide comments or recommendations for change or whatever. And then after that has completed and any changes may be made to the proposal based on that public comment, then it comes back to the board for final approval by the department. And the things that we're going to consider today or this morning, all 4 items are in that final adoption phase. And so that's the process as to the way that we follow these items. So Lynette, you may proceed with your first presentation. Thank you.
Thank you. Good morning, Chairman Boyd, Commissioner Noggle, and members of the board. As always, thank you for the opportunity to present this morning. The first item that I am going to present is a request for final adoption for the termination of the postpartum extension 1115 waiver and extension to 12 months postpartum services. Pending Centers for Medicare and Medicaid Services approval, the Department of Community Health proposes to terminate its postpartum extension 1115 waiver, which extends postpartum services to 6 months or 180 days. Upon receiving approval from CMS, the department will extend postpartum services to 12 months under the state plan. In March of 2021, the American Rescue Plan Act was signed into law. Section 9812 of the American Rescue Plan Act extends postpartum coverage to 12 months under the state plan. Per the provisions of the new law, beginning April the 1st of 2022, states have the option to extend postpartum services to 12 months. Accordingly, the department is proposing to terminate its existing postpartum 1115 waiver for the following reasons. The current 1115 waiver only extends services to 6 months. As just noted, the provisions of the American Rescue Plan Act allow states to extend services to 12 months. We've opted to take the approach to extend to 12 months. The eligibility groups will remain the same under the state plan. An opportunity for public comment was held on June the 6th and on June the 9th. Written comments were due on or before July the 1st. We did not receive any oral comments. We did receive one written comment. The comment came from Ms. Shelmika Hodo, who is the Director of the Maternal and Infant Health Initiatives with the March of Dimes. The commenter was in full support of the proposed change, as it will reduce maternal mortality, improve maternal health, and promote early detection and treatment of postpartum depression and related mental health conditions. The commenter also noted that the extension to 12 months will reduce the rate of low birth weight and preterm births, provide wraparound services, reduce healthcare costs, and support providers delivering care in rural communities. In response, the department thanks the commenter for her written comments and her support. Chairman Boyd, I will pause now for any questions from the board.
Are there any questions or comments from the board for Lynette, please? Hearing none, we have been requested that we approve for final adoption. Is there a motion for that approval?
This is Dr. Lee. I motion to approve.
Neville Lee has made the motion to approve. Is there a second?
Cynthia Rucker, second.
Rucker has seconded that motion. All in favor, say aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Lynette, thank you very much. And you may proceed to your next item.
Thank you. The second item that I will be presenting this morning is a request for final adoption of the renewal of the new options 1915C waiver, also commonly referred to as the NOW waiver. Pending approval by the Centers for Medicare and Medicaid Services, the department proposes to renew the 1915C new options waiver program for an additional 5 years. The now is currently scheduled to expire on November the 8th of this year. The now provides services to individuals with intellectual disabilities and developmental delays who are at risk of placement in an intermediate care facility for persons with intellectual disabilities and developmental delays. The Now Waiver provides the following services: adult occupational therapy, adult physical therapy, adult speech and language therapy, behavioral supports consultation, respite services, specialized medical equipment and supplies, supported employment, vehicle adaptation, environmental accessibility adaptation, as well as several other services. As part of the renewal, the department proposes to make the following changes. We will modify the eligibility minimum age to 5, add assistive technology as a new service, modify the following services to reflect telehealth service delivery, and I will list those out now. Adult speech and language, adult physical therapy, adult occupational therapy, nutrition services, interpreter services, behavior support services, and supported employment. We will allow 2 services with low utilization to expire. The 2 services are community guide and natural support training. We will remove participant direction or self-direction as a service model in the following 2 areas: behavior support services and supported employment. And finally, we will adjust the rates to reflect a 7% increase. An opportunity for public comment was held on June the 6th. Written comments were due on or before July the 1st. We did not receive any oral comments. We did receive 10 written comments. The commenters are as follows. C. Edward Grogan, the president of the Home Care Association of America, the Georgia chapter. Mr. Dave Lamb, the legislative chairman of the Home Care Association of America, the Georgia chapter. Nicholas Perry, the chairman of the Georgia Council on Developmental Disabilities. Ruby Moore, the executive director of the Georgia Advocacy Office. Zelinda Stoneman, the director of the Institute on Human Development and Disability with the University of Georgia. Emily Graybill, the director of the Center for Leadership in Disability from Georgia State University. Rena Harris, the executive director of Georgia Options Incorporated. Michelle Swartz, the director of Sangha Unity Network Incorporated. Shelley Shelley Simmons, the Executive Director of the Statewide Independent Living Council of Georgia. And last, Susan Walker Goyko, the Managing Attorney for the Disability Integration Project with Atlanta Legal Aid. The following summary of comments was received. Commenters were in full support of the addition of assistive technology, but requested that internet access be explicitly included as an allowable expense. The commenter further indicated that without this provision, waiver participants may not be able to access the full benefits of the assistive technology. In response, the department states as follows. Medicaid members may obtain a free mobile cell phone through the Lifeline wireless program. The program provides a free smartphone and a free data plan, including unlimited minutes and text. Upon application, members may receive a phone within 3 to 5 days. Members may apply for a free mobile phone by calling area code 614-699-5741 or by logging on to www.georgialifeline.com, and I'll spell that out. www.georgialifeline.com, all one word. Mobile phones may be utilized to access the internet or utilized as a hotspot for internet use. Number 2, commenters recommended that assistive technology be expanded to include additional opportunities to enhance care and reduce overall healthcare cost by incorporating various services such as motion monitors, vital sign remote wearables, gait analysis belts, etc. In response, the department states as follows. The department thanks the commenter for their support and notes that assistive technology is broadly defined within the waiver application to capture technology that will maintain or improve functional capabilities of individuals with disabilities and enhance care. As a reminder, assistive technology consists of any technology, whether acquired commercially, modified, or customized, that is used to maintain or improve functional capabilities of individuals with disabilities by providing an alternative method to perform a task. Third, commenters recommended the addition of specific language that clarifies that telehealth is optional and only to be used when it is determined to be the best modality available to meet the needs of waiver recipients. In response, the department states as follows. Appendix C of the waiver application contains language which provides that telehealth is only to be used when appropriate. The department will also include similar language in the accompanying policy and procedures manuals. Number 4, commenters objected to the revised definition of community living supports extended services. In response, the department agrees with the commenter and notes that this was included in error and an oversight, and the language will be removed. Number 5, commenters indicated that waiver participants have benefited from the flexibility offered under the Appendix K and recommended that the department continue to allow family members to serve as paid support. In response, the department will consider this request for a future waiver amendment and reminds the commenter that members will be allowed this flexibility throughout the duration of the public health emergency, which, as the commissioner just noted, was extended through mid-October. Number 6, commenters recommended that the department maintain the flexibility for services to be provided in alternative settings. In response, settings are defined in the service specification section of the waiver application, and that's section C1 and C3. As a result of the public health emergency, members were granted the flexibility to receive services in alternative settings. This flexibility was allowed pursuant to an Appendix K and will continue throughout the duration of the public health emergency. We request that the commenter submit additional information regarding the specific setting referenced and the specific service for future consideration. And last, commenters were in full support of the addition of telemedicine options to existing services and the 7% increase in the reimbursement rates. And the department thanks the commenters for their full support. I will pause now for any questions from the board.
Questions, comments from the board, please? Hearing none. Is there a motion for approval for final adoption?
I move for adoption. Cynthia Rucker.
Dr. Rucker has moved for adoption. Is there a second?
Dr. Lee seconds.
Dr. Lee will second that motion. All in favor say aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Lynette, and thank you very much for that very comprehensive presentation. Thank you.
Okay, and my final presentation this morning is a request for final adoption to renew the elderly and disabled 1915C waiver. Pending approval by the Centers for Medicare and Medicaid Services, the Department of Community Health proposes to renew the 1915C elderly and disabled waiver for an additional 5 years. The waiver is currently scheduled to expire on November the 8th, 2022. The elderly and disabled waiver includes 2 programs, the Community Care Services Program and the Service Options Using Resources in Community Environments Program, also known as the SOURCE. The waiver assists individuals who are older and or functionally impaired to continue living in their own homes and communities as an alternative to nursing home placement. Individuals served by the program are required to meet the same level of care for admission to a nursing facility and be Medicaid eligible or potentially Medicaid eligible. The waiver provides the following services: adult day health, home delivered meals, skilled nursing services, personal support services, respite care, alternative living services, structured family caregiving, and alternative living services. As part of the renewal, the department proposes to make the following changes. 1, add assistive technology as a new service. 2nd, modify personal support services to allow a relative to deliver the service. 3, allow 5 services with no utilization to expire. They are transition coordination, pre-discharge, transition coordination, month 1 through 6, transition coordination, month 7 through 12, transition services and supports, and transition community integration services. And finally, we're proposing to adjust the rates to reflect a 10% rate increase. An opportunity for public comment was held on June the 7th. Written comments were due on or before July the 3rd. We received 3 oral comments. They were from Julian Jones, a caregiver, Jennifer Crosby from Senior Link, and Miss Vicki Clark. We received 4 written comments. They were received from Donna Knackers, the Vice President of Reimbursement from the Georgia Healthcare Association. 2nd, Miss Nancy Petra, the Director of Government Affairs with the Alzheimer's Association, the Georgia chapter. Mr. C. Edward Grogan, the President of Home Care Association of America, the Georgia chapter, and Mr. Dave Lamb, the Legislative Chairman from the Home Care Association of America, again, the Georgia chapter. The following summary of comments was received. 3 commenters objected to the new restriction included in the waiver application, which prohibits reimbursement to family caregivers who are also approved by the Social Security Administration as a member's representative payee. In many instances, the member's family caregiver also serves as the member's representative payee for the receipt of Social Security benefits. Commenters identified instances wherein a family member serving as the caregiver may be the only individual available to provide care to the member and receive the member's Social Security benefits. An example provided was a daughter who serves as the caregiver and representative payee for her elderly mother who has multiple chronic health conditions. These family caregivers help to manage the member's finances, pay for food, clothing, and other personal items needed for the member. In response, the department thanks the commenters for their written comments. After further consideration, the department agrees to remove the restriction, which prohibits reimbursement to family caregivers who are also the member's representative payee. However, the department will continue to explore additional options to ensure program and payment integrity. 2nd, one commenter objected to the new restriction included in the waiver application, which prohibits reimbursement to a caregiver who is caring for an unemancipated adult. The department thanks the commenter for her written comment. After further consideration, the department agrees to remove the restriction which prohibits reimbursement to a caregiver who is caring for an unemancipated adult. Again, the department will continue to explore additional options to ensure program and payment integrity. Third, one commenter supported the waiver renewal and the addition of assistive technology services that will enrich the lives of the independents of the elderly and disabled program participants. In response, the department thanks the commenters for their support. Fourth, two commenters supported the addition of assistive technology, but requested that the services be expanded and innovative so that individuals with Alzheimer's disease and dementia can maintain the highest quality of life, dignity, and independence. Additionally, the commenters requested that assistive technology be expanded to include remote patient monitoring, motion monitors, medication reminders, as well as a few other items. The department thanks the commenters for their support. And as previously noted, assistive technology is broadly defined within the waiver application to capture technology that will maintain or improve functional capabilities of individuals with disabilities. Fifth, one commenter recommended that DCH remove the 24-member limit for alternative living services group model from the waiver application. The commenter suggested that removal of this prohibition will ensure that Medicaid-eligible individuals living in these community settings have access to waiver services regardless of the size of the community. The department thanks the commenter for their response. However, at this time, the current limitations will remain in place. Sixth, one commenter requested that the department allow family caregivers to provide personal support services. In response, the department states as follows: with certain exceptions, structured family caregiving allows family members who live in the home of the member or vice versa to provide care and support to the member. The waiver participant and primary caregiver must be related biologically or by marriage, but may not include legally responsible adults, such as parents of minor children or spouses of the waiver participants. Additionally, as noted in the public notice document, the department is proposing to allow relatives to deliver personal support services, whether family live in the home of the member or the reverse. Next, one commenter recommended that additional slots and funding be provided to keep up with the current demand and the future demand as the population ages. The commenter indicated that the elderly and disabled population will exceed 3 million by 2023, and that those who qualify for Medicaid and need CCSP and source services should be able to receive services. As a reminder, currently, there is no waiting list for this waiver. All approved applicants are receiving services. However, the department will take this under advisement. Item number 8, one commenter was in support of allowing a relative to provide personal support services. We thank the commenter for their support. Number 9, one commenter recommended that there be parity in reimbursement rates for all of Georgia's 1915C waivers. In response, reimbursement rates are based upon available funding. Thus, depending on the funding for each specific program, there may be variations in reimbursement rates. Additionally, reimbursement rates incorporate the various acuity levels and populations served. And the final comment, one commenter recommended that the out-of-home respite care reimbursement rate be increased to mirror the rate for extended personal support services. The department will take this under further advisement and appreciates the comment. That concludes the summary of public comments, Chairman. I will now pause for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval by David Cruz.
David Cruz has made the motion for final adoption approval. Is there a second?
Roger Folsom, second.
Roger Folsom has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Lynette, and thank you very much. I think what we saw with Lynette this morning and all of her comprehensive presentation, that we see why the public comment period is not only favorable and a good thing because several things have changed, but also points out the responsiveness of the department to those comments.
Yep.
And we recognize that and appreciate that.
Thank you, sir.
Thank you very
Thank
much.
you.
In our final presentation, Brian Lipton, Senior Policy Advisor. So Brian, you may proceed.
Thank you, Mr. Chairman, and good morning to you and the board. The rule change that I'm presenting here today for final adoption is a component of DCH's Medicaid Innovation Advancement Project to increase available Medicaid revenue dollars through CMS approval of a series of state-directed payment programs, state plan amendments, and departmental rule changes. The proposed rule change amends the rules and regulations for medical assistance, Georgia compiled rules and regulations 11-3, to create a new section 11-3-11 titled Hospital Directed Payment Programs. These changes establish a new hospital provider payment program pursuant to the authority granted to the department in OCGA 31-8-179.2. Such payments will provide the necessary funding to obtain the federal financial participation for 2 state-directed payment programs that the board has approved for final adoption and are currently being reviewed by CMS. And those programs are the Hospital-Directed Payment Program for private hospitals and Georgia Strong. Provider payments under this proposed rule shall only be used for the specific purpose of the Hospital-Directed Payment Programs, and the amount shall not exceed the amount necessary to obtain federal financial participation. An opportunity for public comment was held on June 8th, and written comments were due on or before June 10th. No oral comments were received. There were 3 written comments received from the following: Carrie Summers, Chief Financial Officer and Executive Vice President of the Georgia Hospital Association, Bryce Gartland, Co-Chief of Clinical Operations, Emory Healthcare, and Victor Moldovan on behalf of the Southeastern Regional Medical Center. The comments from Ms. Summers and Dr. Gartland were in full support of the proposed rule change as an essential component of the hospital-directed payment program, and the commenters noted that this initiative, Georgia Strong, and the hospital-directed payment program for private hospitals all support each other. The department thanks the commenters for their written comments and their support. The final comment was written by Victor Moldovan, a partner at Holland & Knight LLP on behalf of the Southeastern Regional Medical Center, a general cancer hospital under the applicable Certificate of Need laws. This comment demonstrates that general cancer hospitals are specifically named as an exclusion for eligibility to receive payments through Strong and through the hospital-directed payments for private providers. In comparison, this proposed rule makes exclusions under the umbrella of multiple provider groups, including, among others, public, long-term acute care, children's rehabilitative, geriatric, osteopathic, and other specialty hospitals. Mr. Moldovan proposes amending the rule change to duplicate the language from the directed payment programs to specifically name general cancer hospitals as an exclusion. The department thanks Mr. Moldovan and the Southeastern Regional Medical Center for their comment and their interest in the proposed rule, but no amendment is necessary as general cancer hospitals are excluded from the provider payment under the language as proposed. And with that, Mr. Chairman, I respectfully ask for the board's favorable consideration of this item for final adoption. I'm glad to take any questions.
Thank you, Brian. Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
This is
Motion to
Shane, I
approve.
motion, yeah.
I'm sorry, I didn't catch who that was, please, but I need to know that for the minutes.
I'm sorry, I said this is Shane Mobley, I motion.
Okay, Shane, thank you. Is there a second?
Russell Crutchfield, second.
Mr. Crutchfield has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much.
Thank you, Mr. Chairman.
Does anyone know of any new business that needs to come before the board at this time? Hearing none, I will make one further comment and thank the department as usual for the work that goes into preparing for the meeting and the background of that you have presented. And we as a board, thank you and particularly Denisha in getting all this information to us in advance so that we can review it ahead of the meeting. We've all had the opportunity to do that, and that is very much appreciated. My final comment regarding our next meetings, we have 1 month of a year then when we have 2 meetings traditionally, and that is the month of August. And in August, we have our first meeting is August 11. We're returning to the Thursday dates for our meetings because the Monday date is unusual because of some scheduling that we had today, but August 11. And the other meeting, I believe, is August 25. And specifically, as in the past, the first meeting in August will be for the consideration to consider the state health benefit plan and any changes that are proposed in advance of our open enrollment. The second meeting on August 25, the primary subject at that meeting will be a budget presentation. So with that, if there's no further comments or from the board, I will call the meeting adjourned and thank all of you very much for your participation. Have a good day. Goodbye.
Thank you.